All right, Dr. Green, please start.
Good evening.
Good evening.
I'm Dr. Green. I'll be your attending physician in this surgical department. Please, may I know your name and
I'm
age?
Osibowale.
Okay,
I'm
Osibowale,
65
you're
years
welcome.
old. Yeah, thank you.
Osibowale, going through your case notes, I understand that you have been having osteoarthritis for the past 10 years. Is that right?
Yes, that's correct.
Okay, so I'm sorry about what you have been going through for these years, for this number of years. Please, may I know why you came to the hospital today?
Yes, just like you rightly said, I've been able to manage this pain for the past 10 years with some medication. But this morning, I just observed that I'm unable to move the right hip and in serious pains. I think I need a hip replacement at this point.
Osibawale, I'm so sorry for what you're going through right now. And I can imagine how it feels not being able to move your right hip. I'm really sorry you have to go through all that. But right now, with the current situation, we're having COVID. I'm sure you know about that the world globally we're experiencing COVID outbreak. And for that reason, your surgery will not be able to take place. The surgery can only be take place. You go ahead. Okay, the surgery will only be take place in 6 months' time because of due to COVID outbreak. We have large number of patients, so we book them based on their presentation. So we can able to book you now to take out to do the surgery in 6 months' time. Is that okay?
That's unacceptable, to be honest. What does COVID have to do with my present condition? And you are saying I'll have to wait 6 months. Don't you know that 6 months is enough time for one to get paralyzed if nothing is done on time? You seriously want me to wait for 6 months before a surgery can be done for me? That's not acceptable, to be honest.
Mr. Subawale, I can imagine how difficult it can be for you. Actually, it's just because of the COVID. Like I said, we have a large number of patients in our department, so we book them according to when they present. However, I can prescribe some pain reliefs for you to manage your pain. I can also book you on physiotherapy sections that you can attend. All these methods can also help relieve the pain and sustain you in the 6 months' time. Do you understand?
I do, but I've been taking painkillers all this while for the past 10 years, and this pain occurring now.
Osubawale, I assure you, I'm going to give a stronger pain relief. Like I said, in addition, we are going to add physiotherapy to it to enable you get more relief from this pain. Have you tried physiotherapy before?
No, I've not tried physiotherapy, and I think I'll just give it a try now. But my concern now is, what if the symptoms now progressively worsen? What do I do? If I'm doing the physiotherapy, taking painkillers, because 6 months is quite a long time to wait, and symptoms get worse than it is now, what do you expect me to do?
Okay, Mr. Subawale, that's a very good question. Also, you will be coming for regular follow-ups. Then I will also teach you on some emergency signs that if you notice, you can always come to our practice. You can always come to the clinic, regular follow-up, weekly follow-up. Then if you observe some changes, like your right hip getting numb, not feeling sensation on that lip, you can come to the hospital. You can also come to the hospital if you notice any skin changes or swelling on the right hip. You can come to the hospital to get medical attention. Is that okay?
It's okay. That sounds a little bit reassuring. I just hope that I get this surgery done as soon as possible, because I'm really tired of all these serious pains that I've been experiencing for long now.
Okay, Mr. Subawale, I'm so sorry. I understand how challenging it is right now for you, but I assure you with this method we are going to start from henceforth, there will be great improvements. There will be great improvements planning for the surgery ahead.
All right, your time is up. Rate your performance. I think you did well, to be honest. Your composure, the way your composure and everything. I think you really did well. All right. Is there any comment or observations?
She did well. The conversation really flowed well.
Yeah, I agree with
Relationship.
you. The relationship building was fine. Although he was calling me Mr. Oshobowale anyway, I didn't add Mr. to my name. Try to avoid those things. If somebody say, call me this, just call the person by that. Don't try to add titles or anything to the person's name.
Okay.
Any other observations?
Yes, she did well.
Yeah.
And she started very well too. But towards the end, the last task, when she was trying to say calling the emergency, she was saying calling the emergency, as I heard. I don't know. So
You are saying what?
she was saying coming the emergency. That is what she pronounced. Maybe where she pronounced it. So, but what is here is calling the emergency. That's calling the emergency number that she's having pain or something.
Yeah.
So that is what
Well, what I actually heard that she actually said was that coming to the clinic. I don't think she mentioned.
Yes, I didn't mention emergency.
I think she said clinic. But anyway, whatever she mentioned, whether she mentioned emergency or clinic, it doesn't really matter anyway. If she said another thing, maybe calling the hospital or calling it does not really matter. Those 6 criteria there, those 9 criteria they're actually looking out for. Do you understand? The correctness of your treatment and plan is not what they are marking or checking. Is that okay?
Okay.
Yeah. Any other observation? All right, that's fine. Well done, Dr. Green. So we'll take Abiola now. Starts now.
Hello, I'm Dr. Abiola. I'm one of the doctors in this ANT clinic. How may I address you?
You can call me Emeka.
Oh, that's good, Emeka. And what's the name of your boy?
He's Michael.
Oh, great. Okay. How old is Michael?
He's 4 years now.
Okay. From the case notes, I understand that Michael has been having some pain in the ear. Can you tell me what exactly has been happening? Are there other symptoms apart from pain?
Well, for the past 3 days, I initially noticed Michael tugging his right ear, and he has been doing this for 3 days now. And sometimes he kind of cries while doing that. And I've given him some painkillers, which I believe temporarily relieves the pain. However, today I just noticed that Michael has been irrational and irritable. And whenever I try to touch the right ear, he kind of screams. And I'm really worried that something is really wrong with Michael. I don't know. What do you think that could be?
So sorry about that. I know that might be so discomforting watching your son being in such a pain. I've just examined Michael's ear, and I found a peanut covering the ear canal. That might have happened maybe while Michael was playing, and this is actually the reason why he's been in pain and behaving in such a way. So sorry about that. So in terms of, I know you would like to know what we want to do going forward.
Yes, I really want to, like, because I feel so sorry that this happened. I don't know what could have caused that. But are there like treatment options? Are there
Yeah,
things that
yeah.
can be done about this?
We'll take care of Michael, and it will be fine. We'll remove the foreign body using some specialized equipment. The only uh, thing is that we'll have to place Michael on a 24 hours observation, and so that we can watch. The procedure is safe and is a straightforward procedure, but we feared some complication like ear infection, but that's nothing to be worried about. We will take care of him. We'll watch him for the next 24 hours, and also we'll place him on some antibiotics to prevent likelihood of infection. What do you think about that,
Okay.
Emeka?
Yeah, that sounds quite thoughtful of you, but I'm a little bit worried. Apart from the ear infection we are trying to prevent from happening, do you think there might be other complications happening?
Um, The procedure is quite safe, and there are other complications of the procedure, as you can imagine. But you are in this clinic, you will be managed by experts, and you really don't have anything to be worried about. So we're fine.
Okay. That's fine. I'm really so sorry. And just blame myself for what has happened. If I'd been very
Oh,
careful, I don't think Michael would have put these things in
I
his
mean,
ear.
you
It's my
see,
fault.
you don't have to be sorry. Don't worry. If something like that happen, we only advise that in future you watch what is around Michael, like keeping some objects that might be dangerous away from him, such as battery, beads, nuts, and the rest. Keeping them away from him so that he can have some room to play without causing any danger to himself. But I know that you're a great parent and you want the best for your boy. And I can assure you that Michael will be fine. Is there anything I can help you with, Mr. Emeka?
I think these have been very reassuring and very helpful. Thank you very much.
You're welcome.
All right, your time is up now. This is a very nice one. I suppose this is not your first presentation. Maybe you've presented before with someone or something. And I also believe you must have been watching my YouTube channel on speaking.
Yes, I watched your YouTube channel.
Because a lot of points you actually brought in your speaking was really, really very, very nice. And really, do you understand the way you praise the mother, try to reassure the mother, telling the mother that she's very good parents, all those type of stuff. That's really very commendable. Yeah, I think overall it's a great presentation. The only aspect I want to correct is don't try to always allow the patient to land before you interject. Yeah. So if the patient is still talking, just allow the patient to finish. Because when you are interrupting, it doesn't make a good communication skill. So always allow, if you mistakenly interrupt, apologize and tell the person to continue. Is that all right?
Okay, sir. Okay.
Yes.
Noted.
Then the way you enter the presentation was really very fabulous and nice. You were able to sustain the presentation, even your empathy, your relationship building with it was on top, it was top notch. But your resolution at the end was abrupt. Do you understand? So try to end well. Yeah, you finish your presentation. Don't just keep quiet like that. Let it be clear that you've ended this presentation. You'll be like, okay, well, you've already reassured the mother that it's not her fault. Try to avoid this, blah, blah, blah. You can just book an appointment. Yeah. Is it okay if we see Michael again after the treatment to see Michael, let's say in a week time, just to make sure that no other complications develop? You can say yes or no. You now say, okay, so we see you again, let's say in 1 week time after the treatment. All right, bye-bye. You end your pay. Just let the resolution be very clear. Is that okay?
Okay. Okay.
Yeah, overall, it's really very, very, it's a very nice presentation. I can hardly get anything to fault you on. This is a very nice one. Well done. Any other comments from the house? Any other observation? It's okay.
No, he did well. He did very fine.
It is very fine. Yeah, he did a very fantastic job. That's okay. So let's take. Hello, Julie Max. You are very far from your mic, or you are using earpiece. If you are using earpiece, just remove it, please, so that we can hear you. Lady Teresa, please mute your mic. Eze, mute your mic so that the noise level will reduce. Teresa, please mute your mic. I can hear you, but your voice is still far from your mic. I don't know why it's like that.
Sorry, I'm in the car, that's why.
Oh, I see. All right, so can you see this task on the screen?
Yes.
Okay, so you are taking the doctor side. This is the one you are reading. Don't read my own side, okay?
Okay.
You have 2 minutes to go through it, then I'll ask you to start.
Okay.
All right, Julie Max, start. Oh, you're having a lot of noise from your background. Please start.
Okay, all right, good evening.
Good evening.
My name is Dr. William, one of the junior doctors. Can you confirm your name?
I'm Michael.
Okay, Michael. Okay, confirm your age, please. How old are you?
I'm 35.
All right. Michael, can you tell me why you're in the
Well, I've come to request for the results of the test I did a couple of days ago.
Okay, Michael.
Julie Max, we are all struggling to hear you, and the noise from your background is overwhelming. We can't even differentiate your voice, and the voices you are hearing from your background are louder than even you speaking. So it's very difficult to maybe if where you are is not very comfortable, you can try again tomorrow. Is that okay?
Okay, yeah, no problem. I can try to.
All right, that's fine. Yeah.